So now we're going to start into specific classes of drugs. This chapter 13, we're going to skip to the end of the book, is on anti-inflammatory drugs. And from now on, we'll be talking about different drugs that act on specific parts of the body or system of the body. And in this case, we're going to be talking about inflammation and drugs that we have for that. I'd like to start with this particular class of drugs because most of us are very familiar with them. So these are the drugs that you reach for when you have a headache. And there's actually two different types of these drugs. One are steroids. We don't typically reach for those for a headache, but the other types, non-steroidal anti-inflammatory drugs, such as aspirin or ibuprofen, we commonly use. In the animal world, we typically reach for things like Metacam or Rimadyl, or in the case of horses, phenylbutazone. So you may be familiar with these drugs, and so I like to start with this group. So we need to talk about what inflammation is and what causes it and what happens during it before we can talk about how we can work against it and why we want to work against it. So if you look at this paw on the left side of the picture here, this paw is looking pretty bad. This is a combination of something that happened to the paw and something that the animal did to it. I'm going to let you think about that for a minute. Think if you can identify what this particular problem is. But what's going on here is absolutely normal. It's what happens in the body when there's some inflammation. I'll make the comment that this paw was not clipped. That's not a shaved area. The animal did that to themselves. So what happens in inflammation is we may have something like what's on the right-hand side of this slide, and that is a picture of a splinter going in past the epidermis, depositing some bacteria. And fortunately, the body can handle this. We don't die from getting splinters, and neither do animals. And so the response is for to get white blood cells to the area. And in order to get them there and other inflammatory mediators, in order to get them there, we need to bring blood flow to the area. So that's one of the cardinal signs of inflammation. We'll have blood flow will increase to these areas. It is set off by the release of histamine from mast cells that are influenced by mediators that are responding to the tissue damage. And so we start to get more blood flow, some permeability to the area. Too much blood flow will actually cause swelling because the blood is being kind of pumped in there at a rate that is too much for the blood vessels to handle. They become a little more open, and so we start to release fluid into the area, so we have swelling. That also brings heat from all that blood coming into it. So those are three of the five signs of inflammation: redness, heat, and swelling, or edema, as we would call it. And then with that also comes pain. So the inflammation mediators touch on the nociceptors of the nerves. And we don't talk a lot about that in this class. You will be talking about that more in pain management in your anesthesia class and go into how pain works. But your book does have a chapter on that, and you're certainly welcome to read that. But for what you need to know here is that there are nerve endings, all over the body, and these inflammatory mediators set them off, and so we get pain. And the last of the signs of inflammation is loss of function. That's when it goes to the extreme. Now in this dog's paw over here, so maybe it was a little splinter, maybe the dog um, brushed up against something that poked it and caused it to start licking at it. This is called a lick granuloma, or hot spot is sort of the common name for it. And so it became irritated. The dog went after it more. That increased the irritation. And so we're losing fur, we're losing, the top layer of epidermis, and this is not helpful inflammation. So the original insult is probably gone. It's just simply the dog continuing to cause more inflammation. So what we do, just so you know, to treat this is we would put on something very soothing. So we'd put on a triple antibiotic ointment that would have a steroid in it, and steroid is an anti-inflammatory. That would cause the itchiness and a little bit of the pain to maybe be relieved. And then the dog would also get an e-collar or a bandage on this, or maybe both, some way to stop the process. If we stop the dog from licking at it, it has time to calm down and heal, and it won't be causing the dog to want to continue to lick at it. So that's a hot spot. Very, very common. You'll see these in practice. So anti-inflammatories are divided into two different types, and I've talked about one, steroids, if, to be used topically for that dog's paw. And some examples are prednisone and dexamethasone. Cortisone is a topical one that's in a lot of ointments that we use to treat things topically. We don't use a whole lot topically, right? Because it's hard to keep topical things on animals that will lick them. So sometimes we have to go to the oral types or injectable to get things to calm down. And then the other type are nonsteroidal anti-inflammatory drugs, also known as NSAIDs. And examples of those are aspirin, Rimadyl, Daramax, Metacam, in the horse world, phenylbutazone, otherwise known as Bute. So how does the inflammatory pathway work? Because this is the processes that I showed you with that splinter going into the skin sets off some definite processes that fortunately we can use NSAIDs to work on. So, and steroids, sorry, steroids and NSAIDs, anti-inflammatories. So if you remember, the cell membrane is composed of a bilipid layer. It's phospholipids. And when they're injured, there is an enzyme that comes out, and it's called phospholipase up here on the right-hand side. So um, phospholipase is an enzyme, and this ASE is characteristic of an enzyme name. So you'll see this name as we go further into the pathway. And the injury causes this phospholipase to come out. It makes the membranes unstable. Arachidonic acid comes out of that. And that's why this is also called the arachidonic acid cascade. So the arachidonic acid interacts with a couple of other enzymes that are present, and they are cyclooxygenase, abbreviated as COX, and lipoxygenase, abbreviated as LOX. And depending on which side of this gets activated, and cyclooxygenase tends to be activated more, we also produce these inflammatory mediators. So prostaglandins have effect on a lot of different parts of the body. And then we have thromboxanes. And then if lipoxygenase is activated, then leukotrienes are produced. All of these things have the potential to continue the inflammation, bring in that blood. The whole idea is to bring in blood and bring in white blood cells, and then from the bloodstream, phagocytes go out into the tissues and help engulf the bacteria, and the animal can heal. But if it goes on too long, or if it then incites a reaction by the animal to attack that part of the body, that is not good. So we want to control this inflammation pathway sometimes. And I have the word corticosteroids up here. We're going to start first talking about steroids, and corticosteroids is the more proper term. And I have it up here because corticosteroids act to suppress phospholipase, this enzyme. When we suppress that, we suppress the rest of the cascade. NSAIDs, that we'll talk about in the second part of this chapter, act on cyclooxygenase and lipoxygenase. So they react further down in the inflammatory cascade. So steroids work a little higher up, can be a little more effective in blocking inflammation. So anti-inflammatories relieve pain and also just general discomfort like itchiness by blocking that inflammatory process. They have a direct analgesic effect, but they also have this control over the inflammation that then causes the pain to begin with. And they act in different places. Steroids inhibit phospholipase, NSAIDs are further down in the cascade. And I have this football picture here to remind me and remind you that these types of steroids that we talk about are not the type that build muscle in athletes. These are actually what we call catabolic steroids. They actually will break down muscle in animals. So I just want you to be sure to know that these types of steroids are not the ones that build muscles. Those are called anabolic steroids.